So I had my first checkup, a 20-week appointment where they check all of his organs. They did the ultrasound, and I mentioned that he had stopped moving as much as he normally does. He was a big mover. He always kicked and moved around a lot, and it slowed considerably. So that's when they decided that they should induce me and do a C-section at 37 weeks the following week.
He had a very rapid heartbeat, so it was tachycardia, and his heart rate was 285 beats a minute. They wanted to give him a medicine that will stop the heart and then kickstart it back on. His heart rate finally went back down to a normal rate of 165, but they all agreed they did not want to take any more chances with him, and they said, we really think that you need to go to Children's Hospital of Philadelphia at this point.
From day one, all the specialists came in, including genetics and gastrointestinal. Genetics came back a couple weeks later after the initial testing and said he definitely had 22q duplication, which I only found out I had when I was pregnant with Finnegan with the genetic test.
22q microduplication is a genetic disorder. Some of the more common things is a very high arched palate in your mouth. There could also be some brain deficiencies or learning disabilities in the future. So we won't really know for another year or so as he starts to develop if there really is any actual other implications from the 22q. The disorder that was found with that gene was actually founded by a doctor at Children's Hospital of Philadelphia back in the 70s. That is still the doctor to this day that has been working with us.
He's doing great. A lot of it's now just follow-up care. He has a physical therapist who comes once a week. He has an occupational therapist who's working on his feedings every other week. He has a nurse in once a week to check his vitals, check his lungs, and make sure he's remaining healthy. Lancaster General Health now has, at the Suburban Pavilion, a lot of the Children's Hospital of Philadelphia specialties coming there. Gastrointestinal is already there. We see cardiology there, see pulmonology there. Plastics and ophthalmology, another one we see often, are coming there now, which makes our life a lot easier.
It is like night and day to see Finnegan now. He's laughing all the time, smiling, just knowing how far our son has come. It is because of the entire team. Every one of the doctors, nurses, the staff, they treated Finnegan like he was their own child.
They gave us our son back.